are you today?
Good, how are you?
Good, thanks. Are you here for the screening?
I am.
All right. Can I get your first name, please?
Yeah, it's Ben.
Ben? Ben, and what is the first letter of your last name?
M.
M? All right, I have some paperwork for you to fill out.
Okay.
So, here we have, I need you to fill out the front sheet of this.
Okay.
This is our liability release. I need you to sign and date it. Please read through the whole thing. The most important thing to note is that you're going to have a chance to have an HIV test during the screening. And if you choose to have the test and it comes back positive, we have to report it to the states. You can decide when you get back there that you don't want the HIV test, though, please.
Okay.
And like I said, everything's really important, so just make sure you read through it.
Sure.
If you can fill out the red box on this form, on this sheet, if you would like a flu shot, the highlighted sections, and then sign and date. And this is a red, if you can do the red box. And the blue sheet, front and back. Whoops, sorry. And then as soon as you're done with all that, if you want to come back up, and we will get you started.
Okay.
All right,
Perfect.
there you go.
Thank you.
You're welcome. Did you get it all filled out?
Yeah, I did.
Perfect. I'm just going to take a look at it real fast. Forgot to fill in your number. Actually gonna just in case. All right. All right. If you want to go ahead and have a seat, and we'll call you as soon as we're ready for you.
All right, thank you.
All right. Thanks.
Hey, how you doing? I'm Dr. Walsh.
I'm Ben.
Good to meet you, Ben.
You too. Dr. Sheehan. Ben, nice to meet you. Nice to meet you.
I'm Jared, physician assistant student.
Go and take a seat, Ben. I'll take a look at your paperwork. How's your night going?
That's going pretty well.
What have you been up to today?
Just went to school and went to let my dog out.
Went to let your dog out? What kind of dog?
She's a Maya.
Cool. I'm just looking at some of your paperwork here, and it looks like on your hepatitis C form, you marked a few of these risk factors. So you've been exposed to needles and sharps that had human blood on them.
Yeah, I used to work in a lab.
Okay.
So there was that risk, I guess.
And then you've shared personal items as well.
Toothbrush, yeah.
Okay. Well, based on those risk factors, you are eligible for our hepatitis C test if you want us to go ahead and run it tonight.
I might as well, yeah, sure.
Yeah. And what about the HIV test? Have you been tested for HIV before?
I have.
You have? How long ago?
It was a couple weeks ago.
A couple weeks ago?
Just down at Alpha.
Okay. And have you gotten any tattoos since then, or
No, I haven't.
anything? Okay. So if you were tested for that, we don't necessarily need to run that test tonight unless you've had a change in status or something's changed since that test.
Okay. No, I don't think I need one.
Okay. Well, we'll go ahead and run the hepatitis C test for you over at the next station. Have you ever been tested before?
Not for hepatitis C.
Okay, great. And throughout this conversation, I think Jared will be grabbing some of your information, your birthday, and things like that.
Okay.
And I can go ahead and clean up and get my gloves on while he's asking me some of those questions.
Sure.
Thanks. So Ben, tell me what's going on with your teeth. Have you been having any problems or pain or?
Just some mild sensitivity, I guess.
Yeah, along the gum line or?
Yeah, when just like if something's super hot or super cold.
Okay, and that's generalized all over or
No,
on one
it's
tooth?
actually just kind of right up here, I guess.
Okay, well I'll take a look. When was your last dental exam?
Oh, jeez. It's been quite some time.
Okay. And when you have that temperature sensitivity, you eat something cold or eat something hot, does it hurt for a long time or is it intermittent?
Yeah, it goes away almost immediately after the stress is gone.
Okay. Well, let's go ahead and take a look. I'm also going to do a intraoral cancer screening for you today, so I'm going to be looking at some of your tissues. And I don't need x-rays or anything to do that portion of the exam. I'll look at your teeth, and I can see some things visually, but depending on what I see, dental x-rays and a thorough exam with a dentist that has instruments and can refer to the x-rays is going to be in the cards for you, okay? So if you want to open up for me. So Jared, every time we have a PA student, we like to talk about what we're looking for. Ben, if you don't mind, I'll just kind of chat with Jared while I'm looking, okay? Go and bite together for me. So I'll be checking his soft tissues. I'll be looking at his keratinous tissue, this attached tissue here, and his mucosal tissue. I'll be trying to eyeball where the roots of his teeth are and see if I see any swelling or any drainage from his tracts or anything like that. And as of right now, I'm not seeing anything concerning associated with that area that's been in pain. Go and open big for me. Can you stick your tongue out for me? Thank you. I'm going to just check the lateral borders of his tongue here. And I don't mean to talk about you with you sitting here. It's good to teach him here. Have you ever been a smoker at all?
It used to be.
It used to be? Okay. Stick your tongue out for me again. Dr. Shane, you want to look at that?
Yeah.
Do you bite your tongue often?
Not often, but I occasionally bite my tongue.
Okay.
Do you have a little bit of go and stick your tongue out for me. You have a little bit of a white lesion along the lateral border of your tongue. It's something that when I see someone in my dental practice, I like to see them 2 weeks later, 3 weeks later,
Okay.
and follow up. So normally I take a picture, I take a measurement, and I note it. And it's something that I like to check out immediately to see if it's resolved or gotten worse or changed. So I will probably be, do you see a dentist regularly?
No, I don't.
We'll probably be recommending you to actually go see a dentist relatively soon.
Okay.
And have that assessed. So go ahead and stick your tongue out for me again.
When you smoked, was it how much were you smoking? Was it quite a bit? Or
No, it actually wasn't much at all.
like here and there? Or were you smoking like
Yeah.
half a pack a day? Or
No,
anything like
nothing
that?
quite that much.
Okay.
I've never actually even bought a pack, but I used to live with people who smoked, and so I would occasionally just
Have a
have
smoke here and there. Okay.
Let's take a look elsewhere here. I'm not seeing anything associated with that area that's been having pain. So I think at that point I'd want to take a radiograph, an x-ray of that site.
Okay.
What it's sounding like is you have a cavity there, but it doesn't sound like it's something that's deep enough that you need a root canal or have the tooth pulled or something. But we just can't see it without that x-ray. Other than that, you have beautiful teeth. You're doing a great job at cleaning them. So towards the end of this, very nice straight teeth. So no missing teeth. Some little bit of gingival inflammation. No periodontal disease. No missing teeth. Nothing appears to be loose.
You said there was a cavity present?
Possibly.
Possibly, yeah. Let's go ahead and mark it to be safe. And then oral pathology in the other section. Go ahead and write, or just right at the bottom, write 3 millimeter by 3 millimeter white patch, left lateral border of the tongue. All right, well, what we can do is we can walk you to the next station, and then before you leave here tonight, I think it's one of the last tables, you'll be able to get a referral to a dentist and be able to come get checked out, okay?
Okay. Along with your cholesterol, is this your shirt?
I can do both, but I just with this one. So.
Okay. And your name's Benjamin?
Yes.
Good to meet you. I see you qualified for your hepatitis test, so let's get started with that.
Okay, sounds good.
Sorry, hands warm?
A little cold.
A little cold? Yeah, it's a little cold out there.
Yeah.
Could I see your finger there? Sure. All right. Let that dry off for a second.
I have not. I wiped it after. This one's the other one. So I wiped it after.
You dry one?
That's why I did this HC first, and then I wipe it, and then I collect the wipe. It's just
Get a little sting there. It shouldn't be too bad.
It is for me too. Oh, look at that! You're giving me. Yeah. She goes, I should be
What?
Look! You're giving. And then you can practice on the other back. I have a hard time. I don't need my favorite bar or anything checked. Because I am already walking back. Did you see that? Did you see that? It was awesome. Yeah. You're awesome.
I can you stand up there for a second?
You can practice with it.
All that, you can go ahead and sit down now. Thank you.
Yeah, let's just right there. Yeah, not sure what happened.
Okay.
Maybe you're
So just take a few minutes, about 5 minutes or so.
Oh, okay.
Need a Band-Aid or are you alright?
It looks like it's good. Okay.
Yeah,
Okay. Got a couple of questions I'm going to go over with you.
Sure.
How long has it been since you haven't eaten food or drink?
I actually haven't eaten much today.
Did you have anything this morning or?
No, I probably had a little bit of water earlier. It's just been one of those days.
So maybe 24 hours or so?
Yeah.
Okay.
You can punch it.
So you had a HIV test also? Just a second, let me take this test over there. I'll be right back.
Sounds good. Thank you.
Okay, so I'm just going to tell you what these numbers mean, and then we'll look at your results.
Okay.
So, have you been eating today regularly?
I haven't.
You haven't? So you've been fasting all day?
Not intentionally.
Not intentionally? You've just been busy, huh?
Yeah.
So no snacking, no drinks, no coffee,
Nothing.
no snacking on candy, anything like that? Okay, so we would consider this actually a fasting result.
Okay.
So the number's a little bit differently if you've been eating. So since you've been fasting, what we consider normal or a goal for your glucose level would be below 99.
Okay.
Cholesterol, the most it would be desirable to be under 200, especially where you've been fasting. Okay, so let's see what you've got. Okay, it looks like your cholesterol is at 160.
Okay.
And your glucose is 85. So,
That's good, right?
yeah, you want your glucose to be below 99, and the cholesterol needs to be below 200, and you're at 160, so they both look excellent.
Oh, great.
So, it looks looks like you're doing things right. Do you have any questions?
No.
Okay.
Hi there, how are you today?
I'm doing pretty good. How are you?
Good. My name is Michelle. I'm from the Idaho State University College of Pharmacy, and we're going to be doing a vision exam for you today. I just need to ask a couple questions. When was your last eye exam?
I don't remember.
Don't remember? Okay. And have you had any changes in your vision? Anything you've noticed?
Nothing that I can tell.
Okay. All right, we're going to go ahead and use this machine, and what it does is it takes a scan of your pupils and does some measurements, and it compares you to a standard. If you're within that range, you're considered normal, and we'll go ahead and give you a pass on this test. If you're outside of that range, you will get a referral to an eye doctor, and you'll be able to get an exam, and you'll do that at checkout.
Okay.
Okay? So I'm just going to turn this on, and I'll need you to just look right here at the nose. And I'll go ahead and show you your reading here. You've gotten a pass, so that means you're within normal limits for this test.
Oh, okay.
And we don't need to refer you. I would recommend that if you do see any changes in your vision within the next year, to go ahead and try and see your eye doctor, okay?
Okay, great. Thank you.
Good to go. Thank you very much.
Hi.
Hey,
Would you please take a seat right here?
absolutely.
What's your name?
I'm Ben.
Hi, Ben. I'm Kelly.
Nice to meet you.
It's nice to meet you, too. So we're going to do a couple of things today. First, I'm going to look in your ear and see how your eardrum looks.
Okay.
And then I will check to see how it moves. And then we will test your hearing, okay?
Perfect.
So first, a couple of questions. Do you ever have any ringing in your ears?
Only after I go to like a concert or something.
Okay.
Started wearing earplugs for that, actually.
So just once in a while?
Yeah.
And when your ears ring, would you say that it's like a little bit or for a long time?
Usually after something like that, it'll ring for maybe a day.
Okay. All right. Now, what about dizziness? Do you ever feel dizzy? No? Okay. And so, just out of curiosity, when you have ringing in your ear, do you feel like it impacts your daily life?
No, not at all.
Okay. All right. So now I'm going to look inside your ear. Okay. Oh, that looks great. Let me go to the other side. Okay, that side looks great as well. Okay. So now, you're okay.
Okay.
So I'm going to stick this in your ear and you're going to feel a little bit of pressure, okay? And that's just air. What we're doing is we're putting a little bit of air into your ear canal just to see how your eardrum moves, okay?
Okay.
Okay. That side looks good.
Okay.
Now we're going to do this side. Okay. So both sides look great.
Cool.
Now we're going to have Laura test your hearing.
Sure. Thank you.
Thanks.
Hey. Hi.
Hi. All right, so we're going to be testing your hearing. Go ahead and have a seat. All right, so you're going to go ahead and slip these guys on.
Okay.
And you're going to hear some really quiet beeps. Even if it's really quiet when you hear it, I want you to raise your hand and then put it back down.
Okay.
Okay? Does that feel okay?
Yeah, feels fine.
All right.
heard everything.
All right, great, thank you.
Thank you.
Hello, come on in, have a seat. My name is Carmen.
I'm Ben.
Ben, nice to meet you, Ben.
You too.
All right, let me take a look at your chart. I'm going to be doing a short physical assessment on you. I'll start with the blood pressure.
Okay.
Maybe if you can slip your arm out.
Yeah.
Okay, while that's reading, I'll just start asking you some questions.
Okay.
Okay. So, do you have any drug allergies?
No,
Are you taking any prescribed medications?
I'm not.
How about any over-the-counter herbal supplements that you
Mm.
take regularly? No? Okay.
Nothing like that.
Would you like a flu shot today?
I actually had one.
You had
back
one
in
already?
November.
Did you have a flu shot last season?
Yes.
You did, okay. All right. As far as your feet go, do you have any altered sensation in your feet, any injuries or ingrown toenails?
No,
No, none of that.
not that I've noticed.
Okay. Blood pressure is 138/95. A pulse of 87. Is that typical for you?
You know, I'm not sure. I know I'm a little, have a little bit high blood pressure.
All right, now I'm going to take some of your information and do a short risk assessment.
Okay.
This is going to just give us an idea of what your risk for a heart attack or stroke is within the next 10 years. It's not definitive, it's just something to kind of give you an idea of what some of your risk factors might be and how you can try to lower that risk.
Okay.
All right, and how old are you?
I'm 27.
Okay. And your BMI, I'm going to go ahead and say it's here. And are you taking any blood pressure medication?
No, I'm not.
Okay. So your blood pressure was a little high, but these machines aren't totally accurate. You know, if you have a follow-up with a doctor, they can, you know, take that blood pressure again, maybe get a more accurate reading and go from there.
Okay.
Are you a smoker?
No.
Are you diabetic?
No.
Okay.
I used to smoke. I don't know if that matters. I don't anymore though.
This is asking for current.
Okay.
So, all right. -1. Okay. According to this risk assessment, you have about a 2.8% chance of having a stroke or heart attack within the next 10 years, which is low.
Okay.
And your heart age is 33. Which is, you know, a little bit older than your chronological age. So this is, I think, mostly stemming from the high blood pressure reading, which is something that you could follow up with.
Sure.
All right. And do you have any other concerns or questions you'd like to bring up?
Oh, no.
All right. Then the next station will be nutrition.
All right, thank you.
you.
Nice meeting you.
Nice meeting you.
So I'm going to take a height and a weight, so if you don't mind moving your shoes.
Oh, sure.
Go ahead and stand with your back to the wall, please. Okay, you can step out. Okay. You're 6'3".
All right.
And we're going to go ahead and take a weight. So go ahead and step on the scale whenever you're ready. Okay, and then if you want to follow me back into this room.
Sure.
Hi, my name is Shelby and I am a dietetic intern. And what we're going to be focusing on today is some nutrition information.
Okay.
So what I'm going to do is just going to tally up your sheet that you filled out, and then we're going to have a discussion. Is that okay with you?
Yeah, it sounds great.
Okay. Okay. Appetite is normal, eating about the same?
Yeah.
Okay. Any recent diagnoses, diabetes, rheumatoid arthritis, cancer?
No, nothing like that.
And how old are you?
27.
Have you had a fever recently or any steroids, corticosteroids? Are you taking them?
No.
Okay. Okay, all looks good there. So what we like to do in the nutrition section is kind of go through what a typical day you might eat. So we like to look at a snapshot of yesterday as kind of a basis to go off
Sure.
of. So if you don't mind running through what you ate yesterday, starting with the morning.
I usually don't eat breakfast.
Okay.
I'm always in a hurry.
Okay.
And then I generally, since I'm in a hurry, don't have time to make lunch, so I'm always eating out for lunch
Okay.
too. And then occasionally in the evening I might make like pasta or something like that, but
Okay.
frequently I also eat out for dinner.
Okay. So how about for yesterday? Was that what you did yesterday?
Yeah, so yesterday I went and had a burrito for lunch.
Okay.
I didn't eat breakfast.
Okay. What
and
was
then,
in the burrito?
some steak and cheese and rice
Okay.
and some salsa. And then I had a soda with it too.
Okay.
It was a diet Coke.
Okay.
And then for dinner, what did I eat for dinner yesterday? Oh, I went to a pita pit.
Okay. Had like one of the wrap sandwiches?
Yeah,
or?
there's
Okay.
like chicken and bacon.
Okay.
And spinach, and also some cheese too.
Okay. Did you have any fruit yesterday?
No,
Okay.
unless you count, I guess tomatoes are technically a fruit. But
You're correct. Okay. So kind of what we ask that is because we like to get an idea of what kind of food groups you're consuming.
okay, sure.
So what I'm going to do is kind of look at your recall and tally up what you got going.
Okay.
So as far as kind of the skipping the breakfast, that's generally something we like to see people eat breakfast, kind of boost the metabolism, get things going in the morning.
Okay.
Even if it's just grabbing something, it doesn't have to be a traditional breakfast food. It can be, I'm going to grab a sliced pizza, or I'm going to have cheese and crackers.
Okay.
It can be anything, so just anything in the body to get it going. Because you've been sleeping all night, haven't had anything, so sometimes we see, the fatigue and things kind of set in.
That makes sense.
Okay. But as far as protein and things, you're looking good. You have the steak and the burrito and chicken. So all looks good there. And I know it's not a typical day. It's just kind of what we're using to collect the data.
Sure.
Okay.
That is actually a pretty typical day.
Okay. Well, then it's helpful. All right. So if it is kind of a snapshot of what you're typically eating, the vegetables is generally kind of recommended to get a few cups of those. And what I have here is a nice handout.
Oh,
Are you familiar with the
I've seen that
iHealth plate?
before, yeah.
It replaced the food guide pyramid.
Okay.
So this is kind of the method that we use in the dietetics profession for healthy eating. And on the back here, it gives you each of your food groups and what kind of is the recommended intake.
Oh, great.
And underneath that is what a portion size of that food group is.
Okay.
So if you're looking at, maybe I want to improve my vegetable intake, well, how can I get that 2.5 cups? Gives you some nice ideas right there.
Great.
So if that's helpful for you, then this is yours.
Yeah, thank you.
And then I have a few more questions and we'll finish up.
Okay.
Do you currently receive food stamps or SNAP benefits?
No.
Okay. Do you utilize the food bank on a regular basis?
No.
Do you do any intentional physical activity, running, riding a bike?
Not really in the winter. Not really nothing at all.
You're not alone there.
Yeah.
If it were summertime or nice outside, would you try and get some physical activity in?
Yeah, I try to walk my dog
Okay.
30 to 40 minutes a day.
Great.
And then occasionally, maybe once or twice a week, I'll
Great.
run.
When
Not-
it's
not
cold
very
outside,
often.
I understand. I do. So, like I said, just variety is really key. Making sure you're getting all those different food groups.
Okay.
And then the back is just kind of a good idea for what we kind of look for and suggest.
Yeah, that's
There are only recommendations. By all means, if you wanted to have 5 cups of vegetables, go for it.
okay.
But just this kind of gives you a nice foundation and a good starting place.
Great.
Do you have any questions about anything else?
No, that's it.
Okay, all right. Well, it was a pleasure meeting you, and we'll get you set on to the next station.
All right, thank you, Shelby.
Thank you.
Hi.
Hi.
It's my stuff.
Sweet. So what's your name?
Ben.
And what's your date of birth?
11/02/1986.
Perfect. All right, have the right person. So today we're going to be going over the results for the viral testing we did earlier.
Okay.
And first of all, we'll go over the HIV testing. You did get a negative or a non-reactive result.
Okay.
And so that just means it didn't test for the last 3 months. If it was anything before the last 3 months, such as like vaginal fluid, semen, breast milk, or blood transfer, that could make you contract HIV.
Okay.
But your results were negative, non-reactive. Did you have anything that you would be concerned about in the last 3 months?
No. I mean, I did have unprotected sex a couple times, but
Okay.
so
Do you know if
I
you're-
was kind of worried about it.
Okay, in the last 3 months?
Yeah.
So the test may have not picked that up, so you would want to come back 3 months after that incident.
Okay.
So, if anything before, you are good for. Do you have any questions on the HIV?
No. Well, I guess I'll just get retested.
Yeah.
At some point.
Okay, and that was the oral swab test.
Okay.
Okay. So with your hepatitis C test, that was also non-reactive, and this one actually takes 6 months to pick up something.
Okay.
So for your body to develop those antigens and antibodies. So this one is only transferred through blood or any fluid that has blood in it.
Okay.
So sharing even a toothbrush or a razor with someone could make you susceptible to it. It looks like you have a job that you could get needle sticks or sharps.
Yeah, I used to work in a lab.
Okay. Was there anything that happened in the last 6 months?
No.
Okay. And then you did share some personal care items such as a
Yeah, I've
razor,
shared,
toothbrush.
toothbrushes with my family members.
Yeah.
Not all the time, but in a pinch,
Okay. Was that in the last 6 months?
No. Just
Okay.
before that.
Perfect. So, yeah, there's also a risk with getting tattoos or piercings. So, and Idaho doesn't require certification or any regulation on that.
Okay.
So you always want to ask them if they use separate ink for each patient or each customer that comes in. And there's also some pamphlets if you have any questions on the hepatitis C or HIV.
Okay.
Let's see. Did you have any other questions?
No.
Okay.
I guess that's it.
Okay. Well, thanks for coming in.
Yeah, thank you.
I'll walk you to the referral table.
Then I can take some of these?
Yes.
I'm Glenda.
I'm Ben.
I'm a pharmacist, and I am one of the faculty members here at ISU. And I'm going to go through this and ask you if you've had any questions. Our job here is to see if there's something that we need to refer you to a medical provider sooner rather than later.
Okay.
And we can connect you to a provider today if we need to.
Okay.
So how did you hear about us today?
I actually saw a flyer in one of the coffee shops I go to.
Great. And it looks like you don't have a primary care physician. How long has it been since your last exam?
I honestly don't know. I think I had one maybe 3 years ago.
Okay. That's all right. And you're rating your overall health as good today. That's a good thing. Okay. Nutrition, no referrals recommended there. Dental, last exam, it's been a while. Okay. But it looks like everything else is okay. There is a little bit of inflammation, so they probably recommended that you increase your brushing and flossing a little bit. All your teeth are there. That's a good thing. Declined. Okay. And they didn't recommend a referral. At the end, I will give you a referral list if you don't have a dentist. There's some places that you can call to get an appointment if you need to. Labs looked good. Vision, that's okay. Blood pressure is a little bit high. Is it normally high?
I am a little hypertensive.
Okay.
But that seemed just a little bit higher than what I've normally seen when I take my blood pressure.
Okay. How often do you check your blood pressure outside of, when you're out and about?
If I see one of those like machines and I get kind of curious, I might jump on it.
Okay.
So,
what do those normally read? Do you recall?
It's usually like in the 130s and 90s, so I guess that's not really that much different.
Okay. So probably something that we need to watch out for. Your age, you're not really in that risk that we need to worry about it, but definitely something to consider. We may need to be treating that in the future. And I would recommend continuing to look at your blood pressure when you're out at pharmacies or the grocery stores, things like that. And if that bottom number, maintains above 90, then definitely, we'll give you some medical referrals.
Okay.
And get in touch with one of them. And it looks like you passed your hearing as well, got the viral results that you needed. So it doesn't look like I need to give you any referrals today. Do you have any significant concerns?
No, not today.
Okay.
I guess the blood pressure was the most concerning thing.
Okay. Well,
and the guy and the dentist said he wanted me to come in a couple of weeks.
Okay. So if we do have, through ISU and our dental clinic, we do have 2 different types of dental visits. We do have one that does a screening visit, and it essentially just they sit down with you, go through, do an oral exam, and figure out what it's going to take to fix your teeth or whatever. Okay. And that visit is $33. We can get you in in the next week. If you have tooth pain, are you in pain now with your teeth?
No, just occasionally. He said I might have a cavity.
Okay. We do also have a get out of pain clinic, and that's at a much reduced cost. They don't do a lot other than to just get you out of pain, and that is about $150.
Okay.
So would you be interested in either one of those screenings today?
Yeah.
Okay. So it looks like we have one for next Monday at 10:30 or next Wednesday at 10. Which would work better for you?
Probably the Wednesday at 10.
Okay. So because our clinic bases their fees on sliding income, we do ask that you bring in some form of income, whether it be your last taxes or a pay stub, something along those lines, so they can figure out how much to bill you. They will do that on a sliding scale. Your appointment's at 10 o'clock. There's always paperwork that's involved, so we do ask that you come in 15 to 20 minutes before your appointment.
Okay.
If you've never been out to ISU before, it can be a little bit tricky to find, so there's a map here included. There's actually a street that goes here, and you kind of go all the way around the building, and you enter it from the interstate side.
Okay.
So hang on to that. And then on here, this is your next steps to medical care. So on this front page are all of our community partners that provide us with appointments, or they treat individuals who have limited or no insurance, either on a sliding scale or free income. Some of them provide more comprehensive services than others. Because your biggest concern is blood pressure, not that it's a minimal thing, you would qualify for any of these different clinics. Where do you live in town? Is it more west end of town, east end?
I live off of 27th, kind of in the north end.
Okay, so a couple of clinics very close to you. The Terry Riley Clinic is downtown, and they do sliding scale and free healthcare for people who are homeless. Okay. They also take insurance as well. So, it looks like you have insurance. They'll accept you there. We actually can get you in with them within the next week as well.
Okay.
Would you be interested in one of those?
Yeah, I should probably go in.
Okay. All right, and it looks like with that one, we have a Monday appointment or a Friday appointment.
Fridays generally work better for me.
Okay. All right. So that one looks like it's at 2 o'clock. We'll plug you in there. What's your address?
2810 Stewart Avenue.
Okay. And your date of birth?
11/15/1986.
Okay. All right. So I will get the rest of this plugged in based on your thing here, and let me give you an appointment time for them. And just like the dental clinic, they also would appreciate if you can bring in your verification of income at the time of the appointment.
Okay.
Their base cost for this one is $30. Each clinic is different, and depending on what they do during that visit, you know, if there's labs, extra charges can incur. It's not a free clinic. They will bill you for services, but again, if you bring in your verification of income, they'll adjust that payment based on your verification.
Okay.
Okay. So you're going to have a busy week next week getting you into the dental clinic and into the medical clinic. If you find that one of those providers doesn't work or you need to change the time, something else changes, this side, like I said, has all of the medical appointments. On this back side is our other dental care. So, you know, if you need to do something else, you can contact one of these other clinics. There's mental health care too. Nothing was found in your screening today. Things change. Those are some accesses there. Hearing and then vision is there as well. So hang on to that sheet and we can go from there. Your next step is motivational interviewing. I'll walk you over there. Do you have any questions about any of the screenings that were done today?
No.
Okay, great. If you do, let us know. Here's your file. You can keep all of those in here. And then you're close to the end.
Okay, thank you.
Hi, I'm Rick.
Ben.
Have a seat, Ben.
Thanks.
Almost finished.
All right.
So, just have a couple of questions for you. One, how was your overall experience with the health screening?
I liked it. Everyone was really friendly. I learned a lot today, which was nice. It was really informative. And at that last station, we set up some appointments, so looks like some of the issues that I guess were found, I might be able to see someone about them, which is nice.
Great. Did you kind of prioritize your health goals as far as what you'd like to deal with first?
Yeah, definitely. I had high blood pressure, so I definitely kind of want to go get that checked out. And also the dentist wanted to check on a possible cavity.
Can you think of any barriers you might face to actually going to those, to following up and going to those appointments?
Just school, I guess. The appointments were kind of, the available ones are in the morning, and that's usually one of the busiest. I'm generally more free in like the afternoon or the evenings.
So are there some things that you can think of that will kind of help to be sure that you can make it to these first appointments maybe? And
I generally set reminders on my phone, so hopefully that'll help me. I try to keep stuff in a calendar too. So hopefully that keeps me, makes me remember.
Okay. And do you have any questions for me or anything? Anything else you'd like to add?
No, not right now.
All right. Well, thank you very much for your time. We appreciate you coming to the screen.
Thank you. It was nice meeting you.
Nice meeting you.